Good morning. What an incredible morning. This is so wonderful. Thank you to the Hilton Foundation for making this possible. I also want to give a shout out to the Hilton Foundation for your contribution and investment in HIV/AIDS, especially for young children who are born to HIV-positive mothers, and we can talk about some of that work. I was fortunate to land my dream job as an assistant professor in the Department of Medicine at the University of California, San Francisco in 1981. And that became ground zero for the HIV epidemic. My research had focused on preventable chronic diseases, and the mantra at the time was, well, we've taken care of the infectious diseases, now let's deal with the chronic diseases. And then HIV hit. And it was terrible, and all hell broke loose. And I knew I had to get involved. My boss at the time said, oh, bad career decision. Don't do it. You don't want to get involved in that. And that comment characterizes the challenge. HIV challenged our society at its very core. We liked to believe that people had sexual relations in only one way. But the human race has great imagination about various ways of having sexual relations. We had to think about our young people and how do we educate them. Now, the 80s were difficult. The early 90s were terrible. Then finally 1996 hit, and we had highly active antiretroviral therapy. I myself have benefited from that. Here I am at the grand old age of 73. Now, I know you're going to say you don't look like you're 73, but I'm from UCLA. We have great plastic surgeons. So, benefiting from those therapies. But then the call came, why should I benefit from those therapies when people in other parts of the world should have those too? Now, remember the pharmaceutical companies challenged in South African court the breaking of the patent. And I said, you're going to lose. And they said, no, we have the rights. I said, you're on the wrong side of the cause. You don't have the moral high road. And in 2003, in the administration of President George W. Bush, the President's Emergency Plan for AIDS Relief was created. And the idea was to bring these life-saving, life-extending, and now preventing drugs to the rest of the world where they were needed the most. I'm honored and humbled to be moderating this panel of three incredible women leaders in the fight against HIV. The fight has been incredible. We've made great progress. We'll talk about that. And we also want to talk about the challenges ahead. Let me introduce the panel. Charlize Theron, Academy Award-winning actor and director, founded the Charlize Theron Africa Outreach Project in 2007, and we'll ask her to talk about that. Mrs. Teresia Otieno is the Regional Coordinator, International Community of Living with HIV in North America, and she's been a strong advocate for HIV-infected women, especially having to do with reproductive rights. And Ambassador Deborah Birx, the Director of the U.S. response to HIV/AIDS and the UN Messenger of Peace, I'm sorry, not the UN Messenger of Peace, but rather the U.S. Special Representative for Global Health Diplomacy. She rose to the rank of Colonel in the U.S. Army, directed the Army's HIV vaccine program, went to the Centers for Disease Control, led the HIV program there, before being appointed by President Obama in 2014. I'm getting my dates wrong. 2014 to be PEPFAR coordinator, which he has continued to this day in the Trump administration. So let me start with you, Ambassador Birx.
Great.
What do you what do you think? You know, we get up every day and it feels like the earth is going to hell in a handbasket. But what do you consider the greatest accomplishments of PEPFAR, and especially your administration of PEPFAR?
Well, I think in the audience today, and thank you for being here, and thank you for such an inspirational morning. I will take everything in my heart and head, because listening was such a privilege. We are grateful to you, the American taxpayer, who when President Bush said, too much is given, much is expected, who stood up when no one else stood up to confront this epidemic globally and said it wasn't good enough that we had treatment in the United States, we had to have treatment around the world. This was on the backs of prior programs attempting to do this, had failed. But he said he believed we could do it. Now, if you've ever been part of a presidential initiative, when a president says you can do it, you make the impossible possible. And that translation of American taxpayer dollars through three administrations, Republican, Democrat to Republican, 3 presidents, 8 Congresses, bipartisan program 15 years ago, bipartisan program today. So at a time when many people can't see the optimism of what we can do together, when we believe in each other together and we have that kind of support, it makes my job easy. In the audience today, and we heard a lovely poet from Sudan, in the audience today, we have a partner who's been working in South Sudan in the depths of the conflict, delivering life-saving medications through PEPFAR into the most remote villages of South Sudan, ensuring that every pregnant woman is tested and treated. Today, there are American citizens, young women, in each of these countries working in the most difficult situations. My daughter at one time was one of them. I was frightened every day. That doesn't change as a mother. But she was out there to really demonstrate how much Americans care. Because it's never been just about the money. It's been what that money has the potential to do. And so we feel a huge moral obligation to each of you and to the clients that we have the privilege to serve around the world. We do have 14 million people on treatment today because of you. We have millions of babies, 2.2 million babies that have been born HIV-free. And we've gone from 600,000 babies infected a year to now less than 100,000. And that is possible because of the relationship between communities and PEPFAR and government. And I put the communities first because that is what makes the program successful. Listening to the communities and bringing the healthcare delivery to them in a way that they can access it. And so where we've made progress, we've decreased incidence by more than 50% in the highest burden countries of the world. What does that mean? That means millions of people are not getting infected today. I'm just going to do one last call out that makes me super proud to be an American and to be part of this program. Is years ago, Charlize stood up for the young women of Sub-Saharan Africa. And I came out of the treatment world. I came out of the Tom Coates world. And so I was sitting listening to her, and I was like, what is wrong with her? Why doesn't she understand that all these people in South Africa are dying of HIV/AIDS because we don't have enough treatment out there, and she's worried about young women's prevention. And she understood something that I couldn't see. And I think that's my bottom line today. We have to listen more so that we can see through the eyes of others what we need to learn. And she taught me that we have twice as many young people in Sub-Saharan Africa than we did 20 years ago. That's twice as many 15 to 24-year-olds at high risk for HIV, and she understood that all the treatment in the world was not going to prevent these young girls from getting infected because many of them were raped, and about a third of them are raped as their first sexual experience. So she opened our eyes. We launched DREAMS, and I just want 2 seconds on DREAMS. Determined, resilient, empowered, AIDS-free, mentored, and safe young women. A non-biomedical program addressing the needs of young girls where they are, keeping them in school, keeping them protected, having parenting and community support, and ensuring that young women can thrive. And that is what a single speech by Charlize did. Because what we have is money, but we have to take issues and action related to what the needs are. And so it's been a privilege to translate data into action, money into success. And finally, to our business people out there, thank you for teaching me. Because I can get a Starbucks any other place in the world and it tastes the same. And I was like, if we can get Starbucks that tastes the same, that cappuccino tastes the same in London as it does in Thailand, as it does in Africa, as it does in the United States, then we can ensure that our programs bring that same quality and consistency. Because a latte is great, but saving someone's life is so much greater. We need to bring that same intensity. So thank you to business for teaching me how to bring a business model to foreign assistance and public health.
Thank you. So in the spirit of listening to communities, Mrs. Otieno, as a woman living with HIV, what is the lived reality on the ground? And what additional needs must we think about to help support these women?
Thank you, Tom. It's really great to be here and to be invited to talk into this panel, because as a person living with HIV, I was infected when I was young, and I've seen all the challenges and the good thing and the successes that the HIV intervention has brought into our lives. I remember when I was being tested and there was no medication and we were filled with despair. I did not even have one child. And I thought, will I ever be a mother? And all of you know that being in Africa and not being a mother is really challenging. And so I've seen the successes and I've seen the good thing about treatment, and I can say PEPFAR and other programs that brought that has really made strides, and here I am. But HIV is not over yet. We still face many more challenges. For example, how can we offer a holistic approach into interventions that we have? How can we engage young people more, especially young people who are living with HIV? Tom, we are facing intersections of issues. One of the political leaders who inspires me talked about that, and it keeps me thinking, who am I? Am I a mother today? Am I an immigrant tomorrow? Am I an activist the other day? I don't live in isolation. We have a couple of things that are really at heart for us. We are facing discrimination, stigma, racism, poverty. But how can we have interventions that are going to address holistically the issues that women living with HIV and other people living with HIV are facing? And I'm glad, Debbie, you did talk about the dreams and PEPFAR. I was involved in one of the projects where I was supporting young women to be able to access PrEP, that is the pre-exposure prophylaxis that prevents HIV. When I was thinking about that program, I thought, if there was that medication, if there was that one pill when I was getting infected, I would have definitely used it, but there was none. Yet, we have the medication now. People can prevent HIV. Why are our young people not using that prevention option? And I thought, if we could design projects, strategies, frameworks in mind, and also consult the young people, consult the beneficiaries, then we'll have better results. In one of the community engagement that I was involved in East and Southern Africa, we brought young women together to ask them, why are you not using PrEP? What is your perspective? What is your view? And they were saying, we need information first. We need to sit together. So any intervention, any agenda that is affecting the communities directly must be championed by those communities. And Charlize did say that during one of the AIDS conference in July in Amsterdam. Let's invest in the communities that are most affected. Then we would have better results. Yes, we have come from far. We have taken medication. I have my two children who are not infected. But we have thousands of women in Nigeria who are giving birth to infected children. We have thousands of young people who are being infected each day. Yet, we are here talking about the far we have come. So as far as we have come, we still have a long way to go.
Thank you. Ms. Theron, so you've decided to invest in youth. And we know that there's a population growth and explosion in many parts of Africa, including South Africa. Why did you focus on youth? And what is the approach you're taking to try to address their needs?
Thank you so much for having me here today. It's an honor to sit here with these two ladies. And I'm so happy you're a mom.
Yes.
I know know that feeling. You know, for me, for those of you who don't know, I was born and raised in South Africa. I am a South African. And growing up in South Africa as a teenager and having this epidemic start to really cause such havoc and not having information really kind of marked me as a young person. And it stayed with me. And as the epidemic grew and kind of devastated South Africa, I mean, this is a disease that buckled my country at its knees. It's very hard to unknow what you know, what you've seen. So for me, it became very clear that AIDS almost obliterated an entire generation of parents. And you had all of these youngsters who were getting misinformation or no information about any kind of prevention when it came to HIV. And I understood very clearly that, like Ambassador Birx said, this need for immediate intervention through treatment and medication, because so many people were dying, was an emergency. It was a state of emergency, but that nobody was kind of looking at the long road. And every time I went back, what I saw was this incredible amount of healthy youth. And I saw potential, and I saw what would happen if they were the future that could carry not only their own country, but the rest of the world, and eliminating this completely. We can't treat ourselves out of this. And I think that watching so many people on treatment was so incredible, but at the same time, I couldn't see my country being on treatment for the rest of eternity. I wanted them to be healthy. Listen, I want this for the whole world, but my experience came from going home and seeing firsthand what this epidemic did to my country, which, by the way, is still the hardest hit in the world.
Yeah.
It makes no sense. We have to be able to understand that. So we have to dig deeper. And I find, since doing this for the last 20 years, we have to, not in AIDS, but starting with the Rape Crisis Center in South Africa, when rape was at the forefront of really kind of perpetuating this virus. And we had to make these connections. What I realize is that we have young people who are falling through the cracks. And they're falling through the cracks because we're letting it happen. And now we're in a place with AIDS where they are the hardest hit. We are looking at numbers dropping, and that's great news. But when it comes to adolescent girls, they're shooting up. And so we have to start paying attention to that. And so for me, it was pretty clear, just because I had firsthand experience, and I was grateful to have that experience. And now, I think for me, what is very clear is that the answers to a lot of these problems and the answers to solving a lot of what we face with AIDS today lies within the youth. We don't listen, we don't ask questions, we push them aside, and they have all the answers. They know what they need, they know how to flourish. And somehow we still have this philosophy of like, we need to tell them. They're the hardest hit when it comes to AIDS, and yet we don't ever have them take a seat at the table. When we make decisions, when we design programs, when we implement, when we look at them to fix them, they're never there. And I think it's a huge mistake. It's an absolutely huge mistake. At the IAC, we had the first youth-centered, moderated debate. That had never happened before. How is that possible? We never had a young person really take center stage at a conference where they're the hardest hit. It just doesn't make any sense to me. We have to put our preconceived ideas of young people aside. They are a fountain of information, and they really have the answers. And then I think we need to stop telling and start listening.
HIV, especially during the era of President George W. Bush, they set the moral compass. They really galvanized the world, and PEPFAR really galvanized the world. And there was the Global Fund to fight HIV, TB, and AIDS. And now we're saying it's a fragile moment. And I throw this out to all three of you. What do you think is fragile, and what do you think we need to do?
Well, I think it's just the way Charlize described it. And that's why DREAMS, the program focused on young women, where we're putting almost $300 million a year into that program to prevent infection in young women, people weren't listening to young women. And so now we have, again, we brought in a public-private partnership, and I just want to emphasize again how much the private sector is critical to us. Because we're public health people. So we say things boringly, and we do a lot of telling without listening. And the private sector, obviously, to sell things to 15, 16, and 17-year-olds has had to listen. And so they came along with us, and they talked to young women in 10 different countries, of the hardest hit countries in Sub-Saharan Africa, and helped us create a program about young women for young women, listening to them and then meeting their needs in each different age group. So in some countries, we've had a 50% decline in the new infections in young women just in 2 years by using that information in a comprehensive way. And in other countries, we haven't. And we had a great talk about urbanization and the role of cities. Africa is urbanizing. There's many young people moving into cities now, and it's particularly the 15 to 35-year-olds, and we don't have inner city programs for them. And see, this brings us back to domestically and understanding, and that's why it's so fragile. When the epidemic in the United States moved into young men of color, our information, our programs were behind.
Yeah.
And we've learned from that to make sure that our programs aren't behind, but they're really, that learning of how to reach young people in inner cities is difficult. It's very difficult, and so that's the fragility. It's as Charlize has said. The number of infections, 1,000 infections a day in young women. This is what this is our crisis. This is our global crisis. And I think that's why it's not just about the money, it's how to use that money in the most effective way to reach young women where they are and to stop the practices that put young women at risk. We also know that a third of young women's first sexual experience, as I said, was rape. We have to stop rape of 9 to 14-year-olds. It just can't be acceptable. As a global community, we need to speak to that. It needs to be times up for these men in these communities that are raping the 9 to 14-year-olds. So it's, as you described, the epidemic is a combination of social issues that we have to address in a comprehensive way, in an integrated way, as you clearly stated, because young women aren't one thing. There are 10, 15 different things, and meeting them in each of those places will ensure that they stay free from HIV.
And I wanted to add that because when I was thinking about coming to this meeting, we had a consultation with the networks of women living with HIV. And Tom, if you'd allow me, I want to read some of the things that women and young women think that should happen. And it says that there's deep structural issues at play, and they are close to our heart. One thing that we need to recognize that violence is a key cause and consequence of the HIV epidemic. The disproportionate high HIV infection among young women and girls is related to social determinants such as gender inequality, abuse of power, and coerced sex, as you've said. Violence and harassment are holding women back. And one of the network of women living with HIV here in the US, the Positive Women's Network, has set aside October 23 as the day to end violence against women living with HIV. So the Love Positive Women, we ask our community to stand with us to end systemic violence. But also, one of the other things that we need to do to engage more is to apply a human rights and reproductive justice lens in our programming, in policy, in research, and even in our funding. One of the things that I've always asked myself and Ambassador Birx, maybe you can talk a bit about that. When you think about the policies that we have, for example, the global gag rule that is really affecting the reproductive justice of women in underserved communities like in my country, what can we do more to reach such women? Why are we not talking about such violation of human rights, which at the end affects how we respond to HIV?
Well, in context to what is just so in the present climate with Time's Up and just this incredible women's movement that's happening right now, I would have to say that what I think is incredibly fragile is women empowerment, young girl empowerment globally. We're having the fight here, and I don't think there's anybody in this room that's not aware of that. And we're making great strides, so we're moving forward. We're doing something that feels like it's gonna stick. It's gonna actually cause some real change for women, finally. In this part of the world where we think women are fortunate, and yet we don't get equal pay, and we are still somewhat considered second-class citizens when it comes to our rights. Now imagine that amplified by 10,000 in countries like South Africa, continents like Africa, Asia, South America. If we want women's rights to move forward in a way where we really take a seat and have an equal partnership, we have to look at women across the world. And when we let young girls die of AIDS, when they don't need to die of AIDS, what are we really saying? We're saying that young girls' lives don't really matter. Well, that pushes us back in our fight and what we're trying to do here. And so I would say that is really fragile right now. We have to start valuing young girls as much as we're saying here that we value women's rights, young girls' rights. We want equal representation. We want to sit at the table. We have to have that for everybody. We can't just have that here in our comfort. And so I would just maybe try to leave you guys with the idea that we are stronger when we all come together. But that means we have to look after each other. And with great power comes great responsibility. I'm not a nerd. That is a superhero movie. But I do think that that is ours. And that's why I wanted to be here today, because I do think that there is we forget the value of our morality and how that has a trickle effect. And that, yes, we can become very compartmentalized and think that, problems are here and we should be looking at what's wrong here and with our neighbor. And it is hard. It is hard. But I believe in my heart that when we set that into a wider scope of the world, we benefit from it. I know that my young girls will benefit from empowering young girls in Africa, empowering young girls in Asia. Because when all of us are empowered, nobody can tell us that we're less. I'll stop preaching.
You hit upon a theme that I hear often.
The superhero thing?
Wonder Woman, which I loved. No, the theme is, in Mayor Garcetti alluded to it in his talks this morning, in his remarks this morning about the tremendous diversity of Los Angeles, which we appreciate. I moved down here from San Francisco 21 years ago, and I met a colleague this week, and she said, "How do you like LA?" I said, "Oh, I love it." She said, "You do?" Kind of like when the dog turns its head and doesn't quite understand what you're saying. It's like, not that I'm saying that, so that wasn't a great comparison, but that's what people in San Francisco do. They say, "How can you like LA?" Well, the diversity is enriching. It's lovely. But I do hear we've got so many problems here. How can we take care of the rest of the world? You must hear that in Congress too. But
I think that, to me, the question is a little bit different because we have realized great support from the current president. And I know some people will say, how can that be true? We do. President Trump supports this program. Secretary Pompeo supports this program and supports it completely. Our Congress supports it in a bipartisan way. But you can't keep, and I think what the alert always should be to all of us, when you have a program, it can't be the same every day. You have to change with the needs of the community, and you have to change with the potential and the science and what you can do. And you constantly have to be asking yourself, are you using those taxpayer dollars in the most effective way down to the clients you're serving? So if you go to pepfar.gov today, you will find every site, all 55,000 of them, on our website, publicly available, completely transparent. Because we want people to see what the American people are doing, but we also want the people in the communities to be able to see what's happening in their community. So we need to take advantage of that internet and to use the data. We change our program every quarter based on the data. Now, companies are doing it daily. This is a big breakthrough in foreign assistance to look at your data quarterly. And I think what this administration is saying to all of us, are we expending our dollars as effectively globally as we are domestically? And do we have an evidence base for the impact that those are having? And I think that's on us in government to be able to prove that a dollar here is having an impact that is as great as any dollar spent in the United States. And that as a global community where HIV/AIDS is a problem in the United States and around the globe, that we're learning from what successes we have globally to translate them domestically and vice versa. So there's a real commitment that comes with those kind of resources. But I think this administration is saying, prove to me that those dollars are as effective. And I think that's on all of us in government to be able to prove that. We are fortunate to have that data, to be able to prove it because we've done the hard work with our partners to get that data and have it available. But if you run a program without data today, in this world of data utilization, you have a problem. And so we all have to get on that same piece, and we have to use our data for action. And I think that's so critical, and we often just talk about graphs, but graphs are people. And when we have that focus on that client and making things better, whether you're in South Central LA or whether you're in the Durban area of KZN, it's the same, and it has to have that same level of impact. There are no excuses anymore in foreign assistance.
We're in this for the long haul for two reasons. One, because we still have a lot of work to do. We need better tools. We have, thanks to US science and science of other countries, we've got some great tools now that we didn't have before 1996. But we don't have a vaccine. I was 10 years old when they gave us the vaccine, and that was a great moment. It meant I could go to the swimming pool again. And we're still chasing down the last cases of polio. So we've got a ways to go. The film clip says stop AIDS, not end AIDS. We can stop it, probably not end it until we get a vaccine. We're also in this for the long haul because of the issues that you raised. This is not just about a virus. It's about social issues, the way women are treated, the way migrants are treated, the way people with HIV are treated. What would you say we need to do to keep running the marathon?
Yeah, I couldn't agree. I mean, we've all touched upon it on some level that we now know that the drivers that get somebody infected with HIV, it is what we need to look at. We can't just look at the person once infected. And when we look at that now, what we realize is we can't treat in any capacity this fight and people who are in this fight without looking at context and looking at lack of economic opportunity, poverty, gender inequality, addiction, alcoholism. We know that when a young girl stays in school, she is less likely to become HIV positive. We know when there's an economic opportunity, there's more a drive to actually have an instinct within yourself to care about your own health, to invest in yourself. And so we know that that holistic approach that we were talking about is the only way to kind of look at this. And when we look at that, we look at an entire society, right? We look at all of the stuff I was kind of talking about earlier too, that we can't tell a young girl, negotiate a condom when she lives in a world where that's not a reality. We just can't do that. So I think context is really important when we talk about all of this stuff. We have to get out of our silo. You know, we can't do this alone. We have to connect with other organizations that bring something to the table that we might not do, and we treat all of our grantees the same way. We like to bring them in touch with each other so that they, as communities, can support each other and maybe bring information from their community to this community that they might never come into contact with. So information is really important. But I think overall, it's what Ambassador Birx said, we can't forget that this is all about people, and we forget that. We get so caught up in things looking okay, driving down the street in La Cienega, and everything looks fine. There is a whole world out there, and when we look at it in context, there are things that need to be done. And I don't know, I feel like I don't know how to live with myself without being part of this fight. I've lived and seen just too much. I feel like I wish I didn't see as much as I did, because it's heartbreaking. It's really heartbreaking, and it's so unnecessary. That's the part that I think kills me. AIDS is 100% preventable. And that's the part that makes me always also feel like, yeah, man, we gotta like fight this, because we can stop it. We might not end it because, like you said, you know, what did you say? Our imagination is too great, and, you know, we won't be able to stop that, but to end that. But we could stop a lot of this unnecessary suffering. And so, yeah, it's not going to be, I don't think anybody who stepped into this, maybe you can answer that, and, you know, as early as you did, thought this was going to be a short road. Yeah, if it was easy, we would have done it by now. But I also feel like because we haven't done it, we can't stop right now.
Yeah.
It's a virus. It's too dangerous. And everything that we feel is not on La Cienega right now, and we can't see it, we will then see it. And I think that's the thing we have to think about.
As women living with HIV, we continue to organize. We continue to support each other. I remember when we didn't have any interventions, when we didn't have medication, we used to visit our fellow women. We used to encourage them to take good nutrition, love themselves, just think about the positive life that they might have, to live beyond the hope. And we continue to do that right now. Women are organizing. We are building movement. But our fundings are shrinking at a rate that we cannot express. No one is no longer interested in supporting community interventions by communities that are mostly affected. To my mind, I think if we can have systems where we fund interventions that bring real change at the community level, I think we'll go miles and we'll achieve a lot. It is okay to fund research and policies, but we know where real change happens in the community, at the community, with the members who are most affected. So as a network of women living with HIV, we organize, we mobilize, we bring each other together to be able to influence the spaces, the decision makings that others are making about our lives, about our reproductive health, and say this is what we want, and this is where we see change needs to happen, and these are the community-owned solutions that really work. Because it is one thing for you to bring medication to me, but I'm the one who decides whether I'm going to take the medication or not. So what are other things that can support me to make informed choices and to live a healthy life and to take care of my children in a better way?
Just real quickly about some of the numbers to just wake everybody up, because I know you're getting close to having that coffee break. The median age today in Uganda is 14.
Yeah.
The median age across Sub-Saharan Africa within the next 5 years will be 19 to 20. They will have the largest workforce for the next 50 years. We have the ability today, like Charlize and others have said, will that workforce be productive and healthy for the global community? Or will a half, a third, or 20% have HIV without enough medication to treat them? We're not talking about HIV/AIDS going away. We have 37 million people who need treatment today. We have to make sure that it's not 100 million 20 years from now, because that is not affordable in a global community. So this is the fragility. We have the choice today to make a future that is very different. and a future where young people are thriving no matter where they are, and it's in our hands. And I think it's incredibly a privilege and a burden, but I think collectively, when we have voices like Charlize, when we have community members that give voice to that, when we have academic institutions that are helping us every day do our stuff better, and we have partners and governments that are so committed, we don't have a choice but have a different future.
I love the focus on youth. Youth, the first 1,000 days, giving people a better start in life. Youth as they grow into puberty, as they grow into young adulthood, and helping them have a better life. I think, in conclusion, what I want to say is, I feel so inspired by you. And we are so fortunate to have you and your inspiration and your commitment and your passion and your leadership. And with that, I think we can stop AIDS. Thank you very, very much for being here.
I'm so sorry about spending my